Hello and welcome to my channel. This is Isaac Sn2ep4. Thank you for tuning in to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel where you should talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Today, we'll be discussing yet another opportunistic infection associated with HIV infection, and in our discussion today, we'll be talking about kaposi sarcoma. Basically, this is an indolent angioproliferative spindle cell tumor that is derived from a lymphatic endothelial cell and immune cell infected with human herpes virus type 8, which we also call kaposi sarcoma herpes virus. Thank you. There are several subtypes of kaposi sarcoma. We have the epidemic kaposi sarcoma, also called AIDS-related kaposi sarcoma. We have the iatrogenic, which is usually occurs secondary to the use of immunosuppressive therapy. We have the classic or sporadic kaposi sarcoma, and we have the endemic kaposi sarcoma. Now, how does or what is the mode of transmission of this human herpes virus that usually cause kaposi sarcoma? Basically, human herpes virus type 8 is transmitted via saliva, can be transmitted by kissing. It can also be transmitted sexually for those who use saliva as a sexual lubricant. Are we together? Thank you. Now, let's talk about presentation. A person who is suffering from kaposi sarcoma may present with lesions or macular lesions or papular lesions or plaques, or they can appear as nodular lesions, mainly on the lower extremities. When they occur on the upper side, they can occur on the back, they can occur along the gums in the mouth, they can also occur in the lungs, and they can occur on gastrointestinal tract. Are we together? Thank you. Now, how do we come up with the diagnosis of someone who is suffering from or who has kaposi sarcoma? It can be done clinically, especially with an experienced healthcare worker. However, we can do chest X-ray and bronchoscopy for those who have a chest presentation or presentation of the lesions in the lungs. To add on that, for the people who have kaposi sarcoma in their lungs, they may also present with difficulty in breathing, cough, which usually is productive with blood-stained sputum. When you do a chest X-ray, you can be able to isolate the lesions, which can be taken biopsy by use of a bronchoscope, and a confirmatory diagnosis can be obtained. For the biopsy, in this case, we are looking for the Lana protein, which is usually from human herpes virus type 8. Are we together up to that point? Thank you. Now, how do we offer treatment, especially for the epidemic kaposi sarcoma, that is the AIDS-related? It's by use of highly active antiretroviral therapy so as to lower the viral load in the person or patient's body. There is use of radiotherapy or use of chemotherapy where radiotherapy is not applicable. For those with a singular lesion, surgery can be a mode of management. Are we together up to that point? Thank you. We can be able to prevent people from getting kaposi sarcoma in several ways. To start with, we can do good adherence to ART treatment for those who are already HIV positive. This may sustain them immunocompetent and they lower the risk of them progressing to AIDS. The other thing, for those especially who get kaposi sarcoma on the iatrogenic way, by lowering the dosage of the drugs that are used to suppress immunity, these lesions can be able to improve. Or for those who have not yet developed the lesions, the chances of acquiring them can be improved. Also, to prevent getting human herpes virus, avoid kissing random people, and also avoid using saliva as a sexual lubricant, and use the synthetic or other manufactured lubricants that are available for those who are dependent on lubricants. Are we together up to that point? This comes to the end of our discussion today. Kindly, if you have not yet subscribed, kindly subscribe. Bye bye.